Hey everyone, and welcome back for another deep dive. Today we're going to be talking all about macrolide antibiotics.
Awesome.
Now these medications can seem pretty complicated at first glance, but I promise you, even just understanding the basics
Yeah.
can really be helpful for making decisions about your own health.
Yeah.
And to help break it all down, we have an expert here with us.
That's right. I'm happy to be here to kind of unpack some of these complex topics.
Awesome. So let's dive right in.
Yeah.
Macrolides have a long history, right? They've been around for a while.
Yeah. It's actually pretty interesting. So the first macrolide erythromycin was discovered all the way back in 1952.
Wow.
From a soil bacterium. So, I mean, it was just hiding in the dirt.
That's wild.
Streptomyces erythraeus is the name.
Okay. And then since then, we've developed other macrolides, right?
Yeah.
Like Clarithromycin and Azithromycin?
Exactly. So we kind of think of those as the semi-synthetic macrolides.
Okay.
Because they are derived from erythromycin, but they've kind of been tweaked a little bit.
So why are these so effective against bacteria? What's their, special power?
Yeah. So it really comes down to their structure. They have a very unique structure. So they have this lactone ring, which you can kind of think of like a scaffold.
Okay.
And then they have sugar molecules attached to it.
Mm.
And this unique structure allows them to bind to bacterial ribosomes.
Now, ribosomes, if I remember correctly, are like those little factories in the bacteria that are essential for their survival.
You got it. That's exactly right. So ribosomes are responsible for building proteins. And proteins are the building blocks bacteria need to grow and to multiply.
Okay.
And so what macrolides do is they actually go into the bacteria
Alright.
and they bind to those ribosomes.
Okay.
And they disrupt that process of protein synthesis.
Oh, so they're like messing up the assembly line in the factory.
Yeah,
Yeah.
exactly. They're basically like gumming up the works. They specifically block the formation of peptide bonds,
Okay.
which are what link amino acids together to make proteins.
So they're preventing them from making the proteins they need to thrive.
Exactly.
Yeah.
And without those proteins, they can't grow, they can't multiply, and they can't cause infection.
So are they effective against all types of bacteria, or are they kind of more specialized?
Yeah, that's a great question. They're definitely more specialized. So bacteria, as you know, come in all different shapes and sizes, and they have different vulnerabilities.
Right?
And macrolides are really good at targeting certain gram-positive bacteria.
Okay.
Some gram-negative bacteria, like Haemophilus influenza, for example,
Yeah.
and then also atypical bacteria. So things like Mycoplasma pneumonia or Chlamydia trachomatis.
So they're kind of effective against a specific group of bacteria, but are there any that they don't work against?
Absolutely. There's no such thing as a magic bullet. So, for example, macrolides are not effective against things like MRSA,
Okay.
Enterococci, or Pseudomonas aeruginosa.
Got it.
So those bacteria have different mechanisms of resistance.
Okay, interesting. So let's do like a little pop quiz.
Okay.
Which of these bacteria is a macrolide antibiotic not effective against?
Right.
A, Streptococcus pneumonia, B, Mycoplasma pneumonia, C, Pseudomonas aeruginosa, or D, Chlamydia trachomatis.
Take your time. Think about it.
Okay, so the answer there is C, Pseudomonas aeruginosa.
That's right.
And that's because it's a tough bacterium. It's known for its resistance.
Yeah, it's kind of a notorious one. It has a lot of ways to evade antibiotics, including macrolides.
Okay, so let's switch gears a little bit and talk about how these medications actually move through the body.
All right, so this is what we call pharmacokinetics.
Okay.
It's basically like the journey of the drug through the body, and it's different for each macrolide.
Okay.
So, for example, erythromycin is best absorbed on an empty stomach,
Okay.
because if you take it with food, it can kind of interfere with its absorption.
Oh, interesting. What about Clarithromycin and Azithromycin?
So Clarithromycin is a little bit more flexible. You can take it with or without food.
Yeah.
And then Azithromycin is a whole other story. So it's actually absorbed really poorly from the gut.
Okay.
But once it gets in, it has this remarkable ability to concentrate in the tissues.
Okay.
And it gives it a really long half-life.
That's why Azithromycin, which is often prescribed as the Z-Pack, is only like 5 days,
Yeah.
but it keeps working for much longer.
Exactly. It's like a slow-release medication.
Okay. So how do you keep all of that straight?
Yeah, so it's definitely tricky. I use this little mnemonic to help me remember.
Okay.
So for erythromycin, I think empty stomach, enteric coating.
I like that.
For clarithromycin, I think can take with or without food.
Okay.
And then for azithromycin, I think absorbed a little but goes everywhere.
Okay, so pop quiz. Which macrolide needs to be taken on an empty stomach? A, azithromycin, B, clarithromycin, or C, Erythromycin.
All right, time's up. What do you think?
Based on our handy mnemonic, I'm going to go with C, erythromycin.
You got it.
All right, so once it's absorbed, where does it go?
So once it's absorbed, it's distributed throughout the body, gets to all the different tissues, organs where the bacteria might be hiding, reaches therapeutic concentrations in all kinds of fluids and tissues, lungs, tonsils, sinuses. And actually, there's a fun little tidbit about clarithromycin. So clarithromycin actually has an active metabolite.
Oh.
So 14-hydroxyclarithromycin, it also has antibacterial activity.
So it's like a 2-for-1 deal.
Yeah, exactly. So it kind of adds to its effectiveness.
So we've talked about what they are, how they work, how they move through the body. But I know there's more to this story, right?
Absolutely. We still have to talk about side effects.
Okay.
And then also the growing problem of antibiotic resistance.
All right. Well, let's maybe take a quick break.
Yeah, good idea.
And then we'll come back and we'll talk about those topics.
All right, so let's talk about side effects.
Okay.
Now, it's important to remember that any medication can have potential side effects.
Right.
And macrolides are no exception.
But not everyone experiences them, right?
Exactly. Not everyone experiences side effects, and oftentimes the benefits outweigh the risks when you're treating an infection. But it's definitely important to be aware of them. So one of the most common side effects that people experience with macrolides is GI distress.
Okay, what does that include?
So we're talking about things like nausea, vomiting, diarrhea, abdominal cramps.
Okay, yeah, not fun. Why do they cause that?
Yeah, so it's not entirely clear why, but we think that it's partly due to the fact that they can irritate the stomach lining.
Okay.
And they can also kind of affect the gut's motility, the way the things move through.
So your stomach's just like, whoa, this is not what I wanted.
Yeah, exactly. It's like an upset stomach.
Are there any other side effects that we should be aware of?
Yeah. So there are a couple of other important ones to mention. One is QT prolongation.
Okay, that sounds a little scary.
Yeah, so it's a potential heart rhythm issue that we need to be aware of.
Can you break that down for us?
Yeah. So basically, to understand this, we need to talk about how the heart beats. So the heart has its own electrical system that controls the rhythm of the heartbeat. And so when we look at an electrocardiogram or an EKG, we can actually see this electrical activity represented. And there's something called the QT interval, which is basically a measurement of that electrical activity. And certain medications, including some macrolides, can actually prolong that QT interval. So it means that it takes a little bit longer for the heart to kind of recharge between beats.
So that can be dangerous, right?
Yeah, so it can potentially lead to an irregular heart rhythm called torsades de pointe, which is a dangerous rhythm.
So does that happen a lot with macrolides?
Not super common, but it's definitely something that we consider, especially in patients who already have heart conditions or they're taking other medications that can also prolong the QT interval.
So you really have to look at the individual, right?
Exactly. It's all about understanding the individual patient's risk factors.
Are there any other side effects that we should be aware of?
Yeah. One more to mention is hepatotoxicity, which is basically liver damage. And this is more common with erythromycin, that first macrolide that we talked about.
So erythromycin is a little harder on the liver?
It can be. Again, it's not super common, but it's something we monitor, especially if someone's on it for a longer period of time.
Does it go away when you stop taking it?
In most cases, yes.
Okay, good. So macrolides, powerful, but they do have some downsides.
Exactly.
So let's talk about antibiotic resistance.
All right.
It's something we hear about all the time.
Yeah.
That bacteria are becoming resistant to antibiotics and they're not working as well. Is this a concern with macrolides?
It's a huge concern.
Yeah.
And it's not just limited to macrolides. This is a global health threat that we need to be taking very seriously.
So how does that happen? How did they become resistant? It's like they're outsmarting the medications.
Yeah, it's not really that they're getting smarter, but they are incredibly adaptable. So bacteria are constantly evolving, and some of them develop ways to evade the effects of antibiotics.
So how do they do that?
Yeah, so when it comes to macrolides, there are 3 main mechanisms of resistance. Target modification, drug efflux, and drug inactivation.
Okay, let's break those down. What's target modification?
So remember we were talking about how macrolides bind to the ribosome to block protein synthesis. Well, some bacteria can actually modify their ribosomes. They change the structure a little bit so that the macrolides can no longer bind as effectively.
So it's like they're changing the locks on their doors so the key doesn't fit?
Exactly. That's a great analogy. And then there's drug efflux,
Okay.
which is where the bacteria actually develop pumps that actively transport the macrolide out of the cell.
So they're like kicking it out. They have like little bouncers at the door.
Yeah, exactly. They're like, nope, you're not coming in here. And then the last one is drug inactivation.
Okay.
So this is where the bacteria actually produce enzymes that break down or inactivate the macrolide.
So they're disarming it before it can do any damage.
Exactly.
It's pretty remarkable.
It is. It's a constant arms race between us and the bacteria.
So how do we use antibiotics responsibly?
Yeah, so I think that's a really important point, right? Because the more we use antibiotics, the more we kind of select for these resistant bacteria. And so we want to make sure that we're using them appropriately.
So are there interactions with other medications?
Yes, drug interactions are definitely something to consider with any medication.
Yeah.
But including macrolides.
Okay.
So they can interact with other drugs in a number of ways.
Okay.
Sometimes they increase levels, sometimes they decrease levels.
Okay.
It can be pretty complex.
Yeah, it's a delicate balance.
Exactly. So one of the main ways that macrolides can interact with other drugs is by affecting their metabolism.
Okay.
So our liver is the main organ that's responsible for breaking down medications and getting them out of the body. And macrolides, especially erythromycin and clarithromycin, they can inhibit an enzyme in the liver called CYP3A4, which is involved in metabolizing a lot of other drugs.
So if you're taking erythromycin or clarithromycin with something else, what happens?
So basically, the macrolide is inhibiting that enzyme. So the other drug isn't broken down as efficiently.
Right.
And the levels can build up in the body.
And then you can have more side effects, potentially.
Exactly. Or it can even make the other drug less effective.
So it's really important to tell your doctor everything you're taking, right?
Absolutely. Prescriptions, over-the-counter, supplements. It's really important to give your healthcare provider the full picture so that they can make informed decisions.
Okay, so before we wrap up our deep dive on macrolides, is there anything else we should know?
I think the key takeaway here is that macrolides are a very valuable tool in our fight against bacterial infections, but we have to use them wisely and with a good understanding of the potential benefits and risks.
Yeah, for sure. And it sounds like we all have a part to play in making sure that these antibiotics stay effective.
Absolutely.
Absolutely. So what can we do? How can we be responsible?
Well, I think the biggest thing is making sure that you're following your healthcare provider's instructions.
Okay.
Right. So taking the full course of antibiotics, even if you start to feel better.
Right. Don't stop early.
Don't stop early. Because even if you feel better, those bacteria might still be there lurking.
Yeah.
And then also avoid self-medicating.
Okay.
Right. So don't just take leftover antibiotics.
Yeah.
Or try to diagnose yourself.
Yeah. So before we wrap up, I want to do one last quiz.
Okay. Let's do it.
So we talked about the different ways that bacteria can resist macrolides.
Right.
Can you remember the three main mechanisms?
All right. Let's see if you've been paying attention.
I think I have. So is it A, target modification, B, drug efflux, C, drug inactivation, or D, all of the above?
What do you think?
I'm going to go with D, all of the above.
You got it. You're on a roll.
So they can modify the ribosomes, they can pump out the drug, they can inactivate it.
That's right.
It's amazing how they do that.
It really is. These tiny organisms are so good at adapting.
This has been so interesting. I feel like I learned so much today.
I'm glad.
We've covered a lot of ground. The history of macrolides, how they work, how they move through the body, their potential side effects, the problem of antibiotic resistance.
It's a lot to take in.
Yeah, it is. But I think it's really important information for everyone to know.
I agree.
So for those of you listening, we hope you enjoyed this deep dive into the world of macrolides.
Yes, thanks for joining us.
And remember, even a little bit of knowledge about these medications can help you make better choices for your own health.
Absolutely. Knowledge is power.
So thank you for listening, and don't forget to like, subscribe, and share this episode with anyone else who might be interested in learning more. Until next time.